Well, it is reducing a major problem in sports by half, and Wisconsin high school athletics is on the cutting edge of it. In 2014, the state's Interscholastic Athletic Association started limiting full contact during football practices.
That change, according to a study by the UW, has dramatically cut down the number of concussions. Dave Delozier spoke today with one of the researchers and joins us now. This is really exciting.
You know, Susan and Eric, I mean, this is data and a finding that every single parent should be very, very interested in. You know, for years, sports organizations have looked for ways to reduce the number of concussions in football. This data shows rule changes in Wisconsin are doing just that. Under Friday Night Lights, when you combine the size of the players and the speed of the game, concussions are an unfortunate reality. But on the practice field, a change to rules limiting full contact are also limiting the reality of concussions. Starting in 2014, the State Interscholastic Athletic Association put full contact restrictions on football. The assumption was it would reduce injuries.
So prior to there was conjecture, we're actually taking it from conjecture to evidence.
Researchers at UW School of Medicine and Public Health had the advantage of 2 years of studying concussions in high school football prior to the rule change. After the full contact was limited in 2014, concussions from practices dropped.
We saw about half the number of concussions after the rule change as opposed to prior to the rule change.
While they saw no change in the number of concussions occurring during games, reducing the overall number is significant. And while it hasn't yet been studied in limiting full contact, they believe that there are benefits for athletes that go beyond concussions.
And yes, this is important to understand, but we need to use this as a discussion point in all of these injuries. Let's do things to prevent all of them because they all have a lingering effect down the road. And parents are surprised when you show the statistics. Their son or daughter is much more likely to have a significant knee or ankle injury than ever have a concussion.
Now, the findings of this study are getting national attention, especially in states where rules limiting practice contact do not exist. And Eric and Susan, you know, the author of this study says for those folks in those other states, those high schools, they really shouldn't need to get the mandate to do this. The study speaks for itself, and he says they should just go ahead and do this, even without the mandates.
Yeah, reduce the hitting, you know. If you don't need it, don't do it every day.
And it adds up. Those concussions add up. If you get one, you're more likely to get a second.
Very interesting.
Yeah, very much so.
Dave, thanks a lot.
Thank you, Dave.